Good evening, everyone. It's Suzanne Greenwood here, the Executive Director for the Pharmacy Guild. We're just leaving it a few more moments because there's quite a number of attendees who are still just registering online. So we'll just give it a couple of minutes past 8 to allow some time for everyone to register. For those just joining, we're just leaving it a couple of moments for people to connect into the system. I can see the number of attendees is going up and up. I think we might actually end up beating last night's numbers if we keep going like this. So just giving it a couple of moments, everyone. Thank you for your patience. Thank you, everyone. It's Suzanne Greenwood here. We're just leaving it just a couple of moments to give everyone an opportunity to register. We've got up to almost 900 attendees at the moment, and the number's climbing very fast. So we'll just give it another moment. Good evening, everyone. It's Suzanne Greenwood here, Executive Director for the Guild. We're just giving it a couple of moments. We might just wait just one last minute for people to register. I think we've had another 100 have joined in only the last minute. So if you could just bear with us for one more minute and then we'll kick off. Okay, well, look, I think that's a bit of a reasonable lead time for everyone to join in. We're all quite good at using virtual systems these days. So good evening, everyone. Welcome to tonight's webinar. My name is Suzanne Greenwood. I'm the Executive Director for the Pharmacy Guild of Australia. It's my delight tonight to welcome you all. I know some have already had a long evening with the Guild tonight already, doing a Guild Ed webinar tonight as well that would have just finished that people are coming across from. So look, welcome to join us then. I'd also like to give an acknowledgement of country to an event like this. We are spread right across Australia, and so for all of the people of the lands on which we all are right across Australia, I'd like to acknowledge the elders past, present and emerging. A little bit of housekeeping. Obviously, we've got a Q&A function with the webinar tonight. You'll see on your screens at the top of your screen a little icon with a question mark in a speech bubble. So that's where you can go to post questions. Now, obviously, when we've got well over 1,000 attendees here tonight, we won't really be able to answer all those questions by any means tonight, but we do have a team of people behind the scenes who are moderating and triaging the Q&A. So where there are things that are a quick little question, they'll be answering those. Where they're a simple 1-2, we'll be publishing them so everyone can see the question. But what we are going to do is collate everything and then post a full question and answers, frequently asked questions, onto the Guild website. So we'll let everyone know when the link to that goes live. So we've got some great material from last night as well, when we gave this same webinar that was very much just a members only event. So, so please post your questions and we will get back to you with all of those. And as I mentioned, we did have a similar webinar last night, so we've got some other great material from that as well that we'll be able to post to the Q&A as well. Now, obviously, though, we've all come together tonight because we're talking about the rollout of the COVID vaccine in pharmacy. I'm very proud to say that I had my first jab, the AstraZeneca jab, at the pharmacy in Boona in Queensland on day one of pharmacies being turned on back in June. So looking forward to getting my second one in August, and obviously anyone else online who hasn't had a chance to get theirs, really encourage you to do that and encourage you to do it in a pharmacy now that we're all being activated. So look, it gives me great pleasure tonight to introduce our National President, Adjunct Professor Trent Toomey. Trent's been really leading a lot of our work in this space, and so I will hand over to Trent.
Sorry, Trent, you're on mute.
I'm all right. You think with the amount of Zoom meetings I do, I would learn how to take myself off mute by now. Thank you, Suzanne. I'm going to start with a bit of data. We went live with community pharmacies administering COVID-19 vaccinations in June this year. Those of you that were at APP saw Minister Hunt make an announcement together with Minister Darth from Queensland. And of course, 49 pharmacies were the guinea pigs. They were the very first pharmacies in rural Queensland to start administering COVID-19 vaccinations. And to those early adopters, I say thank you. This month, by the end of this week, in fact, we will have just shy of 500 community pharmacies vaccinating in most state and territories around Australia, with a particular ramp up in metropolitan Sydney, focusing on those 3 local government areas that comprise the hotspot. And I would, for a moment, just like to say how very proud I am as the Guild National President of those pharmacists in that area, of Alex, of Catherine, of Quinn, of all of the pharmacists in the hotspot that are bearing the brunt of the fear that is being presented by many of our patients, but also the bravery of people being able to roll up their sleeve and do the right thing by themselves, their families and their community. And we're going to talk about tonight how the rest of you can be just as brave and can not only roll your sleeve up to lead by example, but also convince your patients that it is the right thing to do by them, their families and their communities. Now, last week we saw an announcement by the Prime Minister of Australia that all of Australia's community pharmacies will have the opportunity to participate in this program. Now, we have just shy of 6,000 community pharmacies, 5,930 in fact in Australia, but only about 5,800 of those are QCPP accredited, so it is compulsory for pharmacies to be quality assured to participate in this program. And on Monday this week, PPA on behalf of the government sent out an invitation to all pharmacies, not just those of us that were approved for AstraZeneca back in April, but those pharmacies that also chose for whatever reason not to volunteer in the first instance to participate. And I will go through in more detail that tonight. So where we are, friends, is by the end of August, up to 5,800 pharmacies will be participating. So there's the Prime Minister. He made that announcement on July 22nd, which was last Thursday, that we were going to get the tens of millions of AstraZeneca vaccines that Australia has produced in the CSL factory down in Victoria, out of storage, out of fridges, into DHL and Linfox supply trucks, into community pharmacies, and of course, into Australians' arms. I'm just going to start by talking about workforce. So the Honourable Alex Hawke is the Minister for Immigration, Citizenship, Migrant Services and Multicultural Affairs, and he made an announcement only yesterday, after months and months of advocacy from the Guild, to ensure that pharmacists were identified not just as doctors, not just as the nurses have been, as essential workers. So pharmacists are now exempt from those hard international borders. So if there is an international pharmacist colleague of yours, a relative of yours, a friend of yours that would like to come to Australia, to what has been a relatively safe place internationally during this global pandemic, then please let them know now that they are exempt from those hard borders and they can apply for a special entry visa to come into Australia, even though our borders are shut. So let's talk about patient eligibility. There has been a lot of misinformation, a lot of contradictory information, and we have, quite frankly, as a community, as a country, over-engineered what is a very simple task. If you're over 18, get the vaccine. And I will repeat that many times this evening. So how many people over the age of 18 are still yet to receive their vaccination? Now, Dr. Philip Chindamo, the Chief Economist of the Pharmacy Guild of Australia, produced this slide for me. And what it shows is that 27.7 million Australians over the age of 20. Now, the reason we've done 20 and not 18 is because the data sets are released by the Commonwealth in 5-year allotments. So over 15, over 20, over 25, etc. But what we know is that over 11.5 or 11.6 million Australians are yet to receive their first dose, and over 16 million Australians are yet to receive their second dose. So because everyone needs 2 doses, there are 27.7 million doses still to be given in the over 20 age group. So that is the size of the market. That is the size of the challenge before Australia. And that is the challenge that community pharmacy will meet head on. We will deliver this, not for the Australian government. We will deliver this for the Australian people so that lockdowns are a thing of the past as we move into 2022. I want to give a shout out here to all of the Guild branches, not just our New South Wales branch, who have done an outstanding job as the epicentre of this latest outbreak, but all of the Guild branches who have been working hand in glove with the National Secretariat to ensure that the legislative environment is in place that enables you to provide this full scope of practice service. So my job, Suzanne's job, running the National Secretariat, is to liaise with the Commonwealth Government. Now, the Commonwealth Government handles remuneration, and we'll talk about that in a moment. The Commonwealth Government handles activation and distribution, but it is still fairly and squarely the responsibility of state and territory governments to enable the pharmacy profession to administer the COVID-19 vaccination. So we would not be here tonight talking about a national rollout program for all of Australia, for all Australians over the age of 18 to get the vaccine from community pharmacy if your guild had not done its advocacy work, not just in Canberra, but in every state and territory jurisdiction as well. So thank you to all of my state presidents and thank you to all of my branch directors. Now, last night I received some feedback, and first thing this morning, the Guild actioned it for you. Feedback we received last night was that there were many Australians, specifically in Western Sydney, that were presenting because they were new Australians and they did not have Medicare cards. So I can confirm for you this evening that it is no longer a requirement for somebody to have a Medicare card to receive the COVID-19 vaccination through community pharmacy. You told us last night, we raised it with the government this morning, and I can tell you tonight that it has been changed. So it is still a requirement for Australians with a Medicare card to give you the Medicare card because it's an important part of ensuring that that record and occasion of service is uploaded to the Australian Immunisation Register. But what this does is it no longer precludes those Australians, those new Australians, those recent arrivals who do not have a Medicare card from receiving this service. Remember, it is in all of our interests to ensure that all of our community is vaccinated. Now, I'm going to talk about the Therapeutic Goods Administration, the TGA, and the Australian Technical Advisory Group on Immunisations, or ATAGI. And I know you are familiar with these acronyms, but I just want to remind you that it is only the TGA. The TGA is the peak body, the governing body that approves medicines for listing in Australia. And the TGA has approved the AstraZeneca vaccine and the Pfizer vaccine for all Australians over the age of 18. I will repeat that. The Therapeutic Goods Administration has approved both the AstraZeneca vaccine and the Pfizer vaccine for all Australians over the age of 18. ATAGI's responsibility is to provide advice on interpretation, but it is the TGA's job to provide approvals. Now, I've done my training, and I know you will all do your training. You have not done it yet, and we'll speak about that in a moment. But this is an exact excerpt from the compulsory COVID-19 vaccination training. And it says, and I'm going to read it verbatim for all of you, COVID-19 vaccination AstraZeneca can be used in an adults aged between 18 and 59 years if the benefits are likely to outweigh the risks for that individual and the person has made an informed decision based on the understanding of the risks and the benefits. This is nationwide. It is not limited to the outbreak or lockdown areas. I know that you may have received different advice in the past, and that was probably true at that point in time, but this is the latest advice from the Therapeutic Goods Administration. So all Australians over the age of 18 are entitled, if they deem it is appropriate for them, to receive the AstraZeneca vaccine from you in pharmacy. I'll talk about informed consent in a moment. So the training updates. It's every pharmacist's responsibility to check their scope of practice in their state and territory. You need to make sure that you have maintained your recency, as in, is your CPR up to date? Have you ensured that you've remained up to date with any latest advice from a ATAGI or the TGA? And some people are not routinely recommended to receive the AstraZeneca vaccine, but there is no contraindication to receiving the vaccine for these people. So it used to be 14 days after receiving another vaccine before you receive the COVID-19 vaccine. That has now been reduced to 7 days. Those people that are pregnant and breastfeeding, those that have a history of TTS or clotting, it is recommended, it is preferable for them to receive the Pfizer, but it is not contraindicated for any of these people to receive the AstraZeneca vaccine. Personally, as a trained COVID-19 vaccinator, if I'm having conversations with my patients, I would advise people that are in the first group to wait until there are 7 clear days, and I would advise the people in the second 2 groups to book an appointment for the Pfizer vaccine, but it is still their individual choice. Pre-screening must be completed after determining eligibility, and we must gain informed consent. Remember, it is for an individual to give informed consent. A vaccinator does not give informed consent. A GP, a pharmacist or a nurse does not give informed consent. The individual gives informed consent. It is also a legal requirement that all COVID-19 vaccinations are entered into the Australian Immunisation Register. That requirement is within 24 hours, but I'll talk about the technical real-time aspects in a moment. Now, just to clarify, anaphylaxis is the only known absolute contraindication to receiving COVID-19 vaccinations. This could be an anaphylaxis experience for either one of 2 reasons. Firstly, after a previous dose of the same COVID-19 vaccine, you could have had an allergic reaction to Pfizer that does not contraindicate AstraZeneca, or vice versa. Or after an anaphylaxis event after a previous exposure to any vaccine component that is also included in the vaccine that the patient is considering. Remember, all patients over the age of 18 are entitled to receive the AstraZeneca vaccine or the Pfizer vaccine. The only absolute contraindication is anaphylaxis for one of these 2 events, but there are preferences for the people that I mentioned in the 3 categories in the previous slides. Now let's talk about the rollout. What we know. Activation of community pharmacies as AstraZeneca vaccination sites will progressively occur in line with available operational and logistical capacity. And I'm going to give you a ramp up timeline in the next slide. Community pharmacies that agreed to be activated to administer AstraZeneca vaccines will progressively be transitioned to also administer mRNA vaccines as mRNA vaccines ramp up later this year. Now, for those of you that have read the expression of interest that was given to you by PPA, you will note that it does not specify a brand of mRNA. This could be Moderna, this could be Pfizer, indeed it could be both, but we have done this on purpose in consultation with the Commonwealth to ensure that you don't have to do another expression of interest process for any subsequent brand that may be approved by the TGA for provision of administration in Australia. So here are the timelines that we know. The assumed events are things that are not negotiable to be able to participate in the program. Firstly, you must have your Australian Immunisation Register ID. I will give you some tips on that in a moment. And you must have done the training specific for the vaccine. So there are core modules and vaccine-specific modules. Now, the timeline that existed before the Prime Minister made his announcement last Thursday on the 22nd had us participating and providing AstraZeneca vaccines not until mid-September. But I can confirm tonight that all Australian pharmacies, all 5,800 that received an invitation on Monday, that submit their application by 11:59 p.m. tomorrow evening, Thursday, that is the absolute cutoff. You will not be given an extension, will receive stock and be onboarded to commence vaccinating Australians no later than Monday, the 23rd of August. You may very well indeed receive it earlier, and there is a focus on onboarding those pharmacies in the greater lockdown area of Sydney first. So if you were in Sydney and you were listening to this, you will be activated before the 23rd, but for the rest of us in Australia, we will most definitely be activated by the 23rd. You can see that the 23rd is the AstraZeneca activations, and you can see the yellow bar at the bottom of the screen there is when we are likely to receive Moderna, the first of the mRNA vaccines that will be made available to Australia. That is likely to occur in October, maybe earlier, but it is only committed by the Commonwealth to receive it in October. So clearly the message to your patients is not just, if you're over 18, get the vaccine. It is you can have your entire dose, your entire first and second dose regimen and be vaccinated against COVID-19 before you would have the choice of receiving mRNA from community pharmacy in October. So the process, here is a copy of the expression of interest that was received by pharmacies on Monday that are QCPP accredited from the Pharmacy Programs Administrator, or PPA. Now, there were two different versions. There were the versions for those pharmacies that were already approved to administer AstraZeneca that needed to update their approval and confirm their eligibility to administer mRNA. And then there was a version for those pharmacies that had not received any approval yet at all. I strongly encourage all of you. Some of you may be hesitant to participate, and I understand that, but I strongly encourage all of you to register and become approved. You can still then choose not to order vaccines if you want, but you cannot opt in at a later date. Please participate, please become approved, and you can always not order, or you can always order at a later date, but please don't miss this window. So it is up to PPA to confirm, based on your completed EOI, that you meet all of the requirements as set down by both the TARGI and the TGA. The only absolute requirement that you must have before you start, there are other things such as the training that you can complete at a later date, is having your Australian Immunisation Register ID. Now, we've had some questions in the past few weeks about which AIR number is the number they are after. So here's the tip. The AIR number format you will be asked to put for the registration has a format of a letter plus 5 numbers plus a letter. That's a letter plus 5 numbers plus a letter. That is the format of your AIR ID that you will have to put into the CVAS system, and I'll talk about that in a moment, but that you will have to be able to be approved. Now, as I said in the previous slide, you must have this completed expression of interest in by no later than 11:59 p.m. tomorrow evening. So of the 5,800 pharmacies that were emailed on Monday, 1,200 had already completed it as of 9 a.m. yesterday morning. Another 1,000, so 2,200 have completed it as of this morning, and I'll receive another update every morning. So we're probably about halfway. So the rest of you, I'd really appreciate it if you could fill that out over the next 24 hours or so. Onboarding and ordering. I said CVAS before because, you know, we always need another acronym, don't we? CVAS is the COVID ordering system, right? Now, you have to have a 2-factor authentication process here. You must have your cohort code and your approval code, which you can obtain both from PPA to be able to access CVAS to order your stock and place your initial order of 300 vaccines. It takes 72 hours once you put in that two-factor authentication for your ordering profile to be activated. Now, every pharmacy in Australia is entitled to order up to 300 for their first dose. Can I please implore all of you to order the full 300 for your first dose? I will talk about what we do with wastage and stock transferring in a moment. Those pharmacies in Greater Sydney are entitled to order up to 600. That was another thing we were able to get changed today that is different from last night's presentation, because of those stellar efforts of the Quinns and the Alexes and the Catherines of the world that I mentioned in my introductory remarks, some of them that have done several hundred today alone. All pharmacies in Greater Sydney, we've been able to get your minimum order, your maximum order quantity, I should say, doubled from 300 to 600. So hopefully that helps with all of you. Now, there is a 3-week onboarding process. Of course, this can be done so much more efficiently and so much more quickly. And so what we've been able to do is go, and I've got those 2 footnotes at the bottom of the screen there for you to take note of, that as soon as you receive your stock, you can start vaccinating. So please don't wait until your planned start date to open your booking portals, to start promoting it to your patients through walk-ins, to start booking up a clinic. As soon as that stock arrives in your pharmacy, you can start using it straight away. The other thing is we've been able to get this 3-week process condensed, specifically, as I said before, for those pharmacies in Greater Sydney, but for pharmacies all around Australia as well, once we get those pharmacies onboarded, from 3 weeks down to 1.5 and 2 weeks, which is how we can get those pharmacies onboarded before the 23rd of August, which is just why it's so important that you hand your forms in by 11:59 p.m. tomorrow night. Now, we're all worried about stock. Another thing that actually, this is one area where the AMA and RACGP and the Guild were able to tic-tac very, very well. So thank you to our friends and our medical colleagues. The Commonwealth has approved horizontal stock transferring, which is just such a common sense initiative, and I really do have to thank them for it. So it is possible now for any approved COVID-19 vaccination stock to transfer stock to each other. So it doesn't matter whether it's another pharmacy or another general practice. You can now transfer stock to and transfer stock from any other approved vaccination provider. You just need to make sure that by 9 p.m. each week, you record that in the CBAS system, that stock transfer has occurred. So the government just needs to be able to track lot numbers and batch numbers. But this is why I'm saying order your full allocation. Order your full 300 if you're anywhere in Australia, order your full 600 if you're in Greater Sydney, because it's going to be a lot easier turnaround time if I can just lend some to my mate down the road, or I can pull some off my mate down the road as well. Now, remuneration. That's what it is. It hasn't changed since it was announced at the beginning of the year, but I just want to draw your attention to the bold remarks at the bottom. The Guild will continue, of course we will. We will continue to advocate and fight on your behalf for proper, fair remuneration. It is not right that another professional does the same job and gets paid twice the amount that we do. The Guild does subscribe to the notion that if you're doing the same job, you do deserve the same pay. And I promise you we are continuing to agitate for that in the background. But what I need you to do, please, is grasp this challenge with both hands. Grasp the challenge with both hands, run with it, and prove to the Commonwealth that we are a reliable partner in vaccine preventable diseases. And then they will have no choice but to acknowledge the value of our network and meet us with better remuneration. Status of platforms. Booking platforms. The Guild is going to be launching, the Commonwealth will be launching their own public awareness campaign. It was filmed today in Brisbane simply because Brisbane's not in lockdown. It will go live on mainstream media, print, TV and radio this Sunday evening, encouraging Australians to talk to their local community pharmacist. The Guild is also working with the Commonwealth on launching our own campaign for if you're over 18, get the vaccine, and we will be using existing Guild assets plus new assets that we will be building to drive Australians to ask their pharmacist. Please make sure that the findaPharmacy.com.au data is correct and accurate. I need you to go onto your GEM database, which is your Guild online portal, and just make sure that the phone number, the residential address, the trading hours, and all of the particulars for your pharmacy are up to date, because we will be directing people to the finderpharmacy.com.au page to drive them back through your pharmacies to have a conversation with you about getting their COVID-19 vaccination. Now, the Department of Health will be providing the Guild once you're approved. So the 500 odd pharmacies at the end of this week, end of this month, the 5,800 pharmacies, hopefully everyone participates by the end of this month, next month. As those batches are approved, the list of pharmacies will be provided to the Guild, and we will activate that on the Find a Pharmacy website, that COVID-19 is an available service from your pharmacy. Now, what we want people to be able to do is to have as easy a possible journey to not just knowing where to get their vaccine, but actually booking their vaccine. So if you're a GuildLink client, we will automatically update the link in the background. So when people click on your pharmacy on the finderpharmacy.com.au page, it will automatically push them straight into your booking portal. Now, if you're a MedAdvisor, you will have to do that yourself. So you will need to make sure that you've updated that URL static link in your GEM database as well, in order for the campaign to push directly into your portal. Now, the GuildLink COVID-19 vaccination module is free for all pharmacies in Australia. Now, this is one thing where we've done the right thing as a good public health partner. It is available for whether you are a Guild member or not. All pharmacies in Australia are entitled to the free COVID-19 vaccination module in GuildLink, and if you are using that module, it will automatically be linked to the COVID campaign through the Find a Pharmacy portal. I also want to just let everybody know that both GuildCare and MedAdvisor are integrated live into the PPA claiming portal. So it's easy for you just to submit your payment request directly, and your payment claim rather, directly from your clinical software. So here's the patient journey. Right from the Guild running that frontline campaign, driving people to the website, into your booking portal, you being able to do the screening, comply with all of the TGA and ATAGI guidelines by checking the Australian Immunisation Register without having to Alt-Tab, live within the GuildCare platform. You will be able to book right then and there their second dose and send a reminder from the platform right out to them that they are coming in on their particular date. And then at the end of the month, you will be able to, just with a single touch, hit submit, and it will automatically claim through PPA for all of those things as well. So it is a complete end-to-end solution. And as I said, as a good public health initiative, the Guild is making the COVID-19 vaccination module through GuildCare available free to all community pharmacies. If you go to the GuildLink website, you will also find a vaccination readiness guide. You can see there that it is downloadable for free, and it's a simple electronic checklist for you to demystify things like PROTAs and minor IDs, and make sure that you integrate with the AIR and you integrate with PPA and all of those things. So GuildLink has done all of that hard work for you, and it's available free on their website. Another great thing that we can also do, and as I said, any door is the right door. So whether they walk in, whether they phone, whether they email, whether they come from Facebook and social media, there is no such thing as a wrong door for Australians to be obtaining this service from their community pharmacy, as long as they do obtain it from their community pharmacy. So I just want to give a big shout out to Taroom Pharmacy. They're one of those early adopters I mentioned early on in my presentation, those 49 pharmacies that started early. They do have a website. It was produced by Guild Digital. If you don't have a website, or you do, and it's pretty arbitrary and it needs a bit of a refresh so it's fit for purpose and modern and has all of the bells and whistles, then check out the Taroom Pharmacy, and you can also talk to the GuildLink guys about building one for you. Now, I just want to talk about the type of model that you provide in your pharmacy, because there are two different types and there's no right or wrong here. Whatever suits you and your pharmacist, whatever suits you and your pharmacy assistants, I'm more than happy for you to run. In fact, you might choose to run both. You can run a clinic model, or you can run a walk-in model. Both are right, both comply with all of the guidelines. Now, I just want to, for those of you that did some of the training early on, you might not be aware of this, and for those of you that are yet to do it, you will read it when you do your training. But the AstraZeneca multi-dose vial, that's what the AZMDV stands for, lasts for 48 hours in 2 to 8 degrees Celsius in your vaccine fridge after your initial draw. So when you take out from the box that multi-dose vial, you pierce it with the drawing up needle. After you have drawn up that initial dose, it can be put back in the fridge and it is good for 2 days. Now, each multi-dose vial has 10 doses. Now, it is completely reasonable. If your staff are doing what Georgina and my staff are doing in Northern Queensland, where we have a badge, every staff member has a badge, every pharmacist and pharmacy assistant has a badge, and I know some of my staff are on here tonight, so if you don't have your badge, ring and ask and I will deliver it to you, which says, ask me about COVID-19 vaccines. Or if you're a pharmacist, it says, I'm a COVID-19 vaccinator. Now, you should always have a vial on the go. If you want to run a clinic from 10 to 2 on a Friday, that's fine too. But I would always recommend you have a vial on the go. Please, you are not going to see this in communication from the Commonwealth, but I can assure you, after conversations with the Minister himself, after conversations with the highest officials in the Department of Health, the government is not concerned if there is some wastage. What we're concerned about is that the spread of the Delta strain could have been prevented, lockdowns could have been prevented if we had more needles in more arms. So if you are worried that some of your multi-dose vial will go to waste, if you are worried that you will not use 5 doses a day, please don't be worried. Please, any vaccine that you can give into any Australian's arm over the age of 18 is not only completely fine with the guidelines, it's actually what we're asking all of you to do. So please don't be worried about wastage, and whatever suits your business model, whether you're a big pharmacy or a small pharmacy, a metropolitan pharmacy or a rural pharmacy, run a clinic model, run a walk-in model, run a hybrid of both. I do not mind. I just want you to vaccinate, vaccinate, vaccinate. So let's talk about quality assurance and training. So QCPP, or the New Quality Care 2020, is all about clinical governance. So it's about you as the registered pharmacist, whether you're an owner, a pharmacist in charge, a pharmacist manager, or a newly registered pharmacist, or whether indeed you're one of our stellar support staff, our hero pharmacy assistants. It's our responsibility to make sure that we have the right systems and processes in place. All staff, pharmacists and pharmacy assistants, need to be trained. All procedures for a vaccination process must be clearly marked down and clearly documented. Now, one of the things that we've done a pretty poor job of as a country is confusing the messaging around COVID-19 vaccines. Now, sure, it's clinically slightly different to an influenza vaccine. We have to observe people for a little longer. The screening process is a little bit more complicated, but it is not that different. If you already have a vaccination procedure, please just use the same procedure. Just make sure that the clinical guidelines as required by the training and the clinical guidelines as required by TARGI and the TGA adhere to. Do not reinvent the wheel. Now, for pharmacists to start with, it is compulsory for all of us to do the training. You can see my 2 certificates there on the side of the screen. It took me a couple of hours. One of the great tips I'm doing is if you want to read every single thing on it, then read every single thing on it. But at the end of every module, there's a great summary, and just pay real attention to the summary. And then if you do the questions, you won't go astray. So please go to covid19vaccinationtraining.org.au and you need to do the 6 compulsory modules, plus you need to do the AstraZeneca module. I'm advising all of you not to do the Pfizer or the Moderna mod. The Moderna one's not quite on there yet, but the Pfizer one is. But please don't do anything else other than this initial 7, because these training modules have changed substantially since they were first put up. So if you did this training all the way back in March or April, you are probably going to need to redo it. So if you haven't done it, do the 6 plus the AZ when we know that we have a definitive date for mRNA, whether it be Pfizer or COVID or Moderna, we will encourage all of you to jump on then so you don't have to redo it. Pharmacy assistants, there's stuff for you to do too. So I would encourage all pharmacy assistants to jump on to the Australasian College of Pharmacy, which is acp.edu.au. There is a free online training for all of you where it shows things that you can do to help your pharmacist run either a walk-in or a booked-in clinic model. There are some administrative tasks, not clinical tasks, that you can assist with supervising, with booking, with screening, and there's a lot of the technical things, just like you do when you help us on the back counter with S2s, S3s, or you help us in the dispensary with prescriptions. There's a lot you can do to assist your pharmacist with running the COVID-19 vaccination training as well. Now, do staff need to be vaccinated? It is not legal to force any staff member to be vaccinated unless there is a public health order. So until such time that state and territory premiers and chief ministers, and this is not a thing for the Commonwealth, release a public health order, all you can do is encourage and lead by example, but it is not compulsory. So I'm telling you to lead by example. Here's my vaccination certificate out of GuildCare. I rolled up my sleeve on Monday. I got the AstraZeneca COVID-19 vaccination in a community pharmacy in Innisfail in Northern Queensland. I encourage all of my staff to not only do the right thing by themselves individually, the right thing by their work colleagues and the patients that they serve, but also the right thing by their loved ones and get their COVID-19 vaccine from their local community pharmacy. Please make sure every single staff member asks every single patient every single time they come into a pharmacy, have they had their vaccine? If you're over 18, get your vaccine. And would you like to have a conversation with our pharmacist? Now let's talk about professional indemnity, because I've had a lot of questions over the past couple of weeks about PI. PDL issued, and I just want to thank PDL for a moment. They have been a long-term partner of the pharmacy profession. They have always been fully supportive of pharmacists practicing to their full scope of practice. And again, they have reached an agreement with Guild Insurance to ensure that all pharmacists are covered to deliver vaccines to everyone over the age of 18. So here is the PDL guidance, the practice alert that was released earlier this month. PDL will be releasing an updated practice alert, I'm told, next week in August. But basically it says, and I'll read it verbatim because a lot of people have been quite nervous over this, and you have no reason to be. PDL professional officers have received several calls relating to the administration of the AstraZeneca vaccine in patients below the age of 60. Whilst ATAGI advice regarding age ranges for AZ vaccine has not changed, recent Commonwealth Government announcements have reiterated that healthcare practitioners, including pharmacists, can, with informed consent, administer the AstraZeneca vaccine to patients under the age of 60 in certain circumstances. PDL has previously confirmed to all members that the PDL master policy with Guild Insurance provides cover for the COVID-19 vaccination when you take reasonable steps to understand and comply with the obligations placed on you by the government approved protocols. This include, but is not limited to, training, standards, directives, clinical guidelines and recommendations for the administration of the vaccine, and are applicable at the time of providing the vaccine. So if you do everything that I'm speaking about tonight, you're QCPP accredited, you've got the training, your staff have done the training, you make sure that you're registered with the Australian Immunisation Register, and you have a conversation about the risks, the benefits, and the options that the patient has, then there is absolutely no reason you shouldn't be fully confident to be able to recommend AstraZeneca vaccine for everyone over the age of 18. There is a no-fault claim scheme. The government has announced that they have established this scheme to protect patients as well as vaccine administrators, so us, in the event of a patient suffering injury or economic loss as a result of the COVID-19 vaccine. Now, I've got another meeting tomorrow afternoon at 2:30 about this. There are a few outstanding issues that the PDL, the Guild and Guild Insurance are working on together with the Commonwealth to iron out. But just to allay some of the fears and address some of the misconception out there, the no-fault compensation scheme is in place and it is to cover all vaccinators, not just general practitioners. So, friends, let's address hesitancy. The public relations campaign that your guild will be launching with the support of the Commonwealth Government is, if you're over 18, get the vaccine. The goal is for all Australians to be fully vaccinated via community pharmacy. The outcome of this campaign will be to push people and pull people to community pharmacy to get vaccinated. And it will have a lasting legacy. It will not only increase trust in the public's mind of community pharmacy, but it will also help us increase the vaccine services through community pharmacy. Your guild is continuing to advocate, as I said before, with all of the state and territory governments to broaden the breadth and depth of vaccines that we can provide Australians through community pharmacies. And I know in the not too distant future, all Australians will be able to be vaccinated against all diseases through their local community pharmacy. And this is a big opportunity. This is a big opportunity for all of us to put the shoulder to the wheel, roll up our sleeve, use whatever analogy you like, to not only ensure that lockdowns are a thing of the past in 2022, but have a great leap forward in our full scope of practice agenda. So here's the timeline. Starting in June with those initial 49 pharmacies, the AstraZeneca rollout will culminate by no later than Monday, the 23rd of August, with all community pharmacies in Australia that want to will be able to provide the AstraZeneca vaccine. The Guild campaign will launch next month, driving Australians to community pharmacies and telling Australians, if you're over 18, get the vaccine. And of course, as the Guild has always had the point that all Australians deserve the choice of all vaccines for COVID-19 through community pharmacy, and we will continue to advocate as soon as stock is available for the mRNA vaccines to also be available so we can start vaccinating those under 18s. And the Moderna vaccine is likely to be the one that will receive 12 years of age and over approval first and be available through community pharmacy first. So next steps, everybody, please make sure you respond to your unique PPA invitation by no later than 11:59 p.m. tomorrow night. If you have not received that, please email support@ppaonline.com.au. If you need any help, email the Guild at covid-19@guild.org.au and we will help you. And remember, not only do you need to submit that form, but please, for goodness sake, do the HW027 form and get your AIR integration happening. Remember, we're here to help you. That's the reason the Guild exists. If there's anything we could be of assistance of, just pick up the phone and call 13Guild or email us and we will be only too happy to help. Thanks, everybody. I will hand back now to our Executive Director, Suzanne Greenwood, and if there are any questions that we can answer tonight, I'm happy to take them. So back to you, Suzanne.
Thank you very much, Trent. Look, we realise that there's been an overwhelming amount of information that's been thrown at everyone tonight. We've got over 70 questions that have been lodged. We've only really published a few where there were kind of themes coming up so that you could see that yours was in the pool to be addressed. So rest assured, we will be triaging all of those questions and responding to them, and we'll publish that response to the website. As mentioned earlier, we have recorded tonight and we'll be publishing that as well for anyone that wants a bit of a refresher. So we'll be able to have all this information to you. Really, the key message though is it's by just a minute to midnight tomorrow that the expression of interest must be returned. So even if you did do the first round and you're in, well, you do have a different expression of interest email that came out to respond to than those who hadn't responded to the first round. So please do pay particular attention to the ones that you received and what you'll need to do to ensure that you're activated at your pharmacy. So thank you very much, everybody. This really is a moment for the pharmacy sector as a whole to really rise up and respond to something that is really improving health and wellness outcomes for all Australians and getting us all back to you know, a normal way of living.
Suzanne,
Yes.
I just had one of our national councillors remind me that I forgot a very, very important point, and that is when someone comes into your pharmacy to get the first dose, please do not let them leave until they've booked in their second dose. So that's a really good tip. I was not explicit on that, so that's why I've got a national council to keep me honest.
Yes, thank you, Trent. And look, a few of the questions that did come up in the Q&A too were about the fact that, you know, we do have some different regulations from states and territories, and there are a couple of people raising the concerns out of the ACT, and yes, that's probably the last.
Yeah, no, happy to address that. So the ACT and the Northern Territory, we have both had conversations with those two jurisdictions, and they have assured us that they will bring their approvals into line before the campaign launches this Sunday evening, but we will continue to be across that. But every other state and territory has no restrictions other than you have to be 18 years of age. But the ACT and the Northern Territory, we're working on those two jurisdictions for you. And of course, Tasmania currently has a restriction that you must be employed in a Tasmanian hospital or Tasmanian health facility. Helen O'Byrne, our president down there, has been working, and she assures us that will also be changed in enough time before your first batch of stock arrives. So we're all over that. The other thing that we're working on is some states only have AstraZeneca approved. Some states still need to put the approval through for mRNA, but as I said, we've got till October to have that done, and we will continue to ensure that those barriers are removed for you.
Absolutely. So thanks very much, Trent. And look, on behalf of everyone that's listening tonight, Trent, we really appreciate your time again to share all this information. So thank you very much, everyone, for attending tonight. We will continue to push out all of that information to you. And obviously a few key things, get your expression of interest back in by 11:59 tomorrow night. Make sure you get onto the training and the free training that's offered as well for pharmacy assistants. And thank you very much for your continuing support of the Guild. Good night, everybody. Thank you.
Good night, everyone.